So one of the most frequently asked questions I get from patients and doctors is if I'm going to be doing intense pulse light for dry eye, what medication should patients stop before they get their treatment? In the old days when intense pulse light first came out and the energy levels were so high and we really could control pulses, and I still was working on the parameters and protocols for dry eye, the list was long. Now the list is very short in terms of medications, but there's some new medications coming out there that are actually kind of changing the game in terms of what you should be asking your patients. So let's go with the tried and true. If a patient's on a tetracycline, either a monocycline or doxycycline, really that medication should be stopped. They could stop it the day of their IPL treatment. So doxycycline tends to make the skin very light sensitive, but with the energy levels that we're using now for dry eye, it's really not going to have much of an effect, but I stop the doxycycline anyway. If you know anything about me, I haven't used doxycycline for any of my patients for years, just because the doxycycline will affect the gut bacteria, the good gut bacteria that controls inflammation. And I find that low-dose naltrexone is a better systemic inflammatory medication to use for my dry eye patients without any of the deleterious effects on the gut. I also use low-dose naltrexone as a sublingual. It gets to the patient faster. So if they're on the doxycycline, I would go ahead and just tell them they can have their IPL that day, but stop the doxycycline as they're going through their treatments. Now, a lot of medications, and actually not even medications, a lot of the stuff that's over the counter now for skin have retinoids in it. And if a patient is using any kind of cream that says youth serum or age booster or anything like that, it probably has a retinoid. Now the retinoids, vitamin A derivative, it will stimulate the fibroblasts to make collagen and elastin. But if a patient is on that, and you're going to be doing IPL, intense pulse light will actually stimulate the fibroblasts to make collagen and elastin, so you don't need to use the retinoid as you're going through the IPL Toyos protocol. So if they're on retinoids, I would tell them to stop. One thing that I have seen, if you don't tell them to stop, the cell turnover is a little bit quicker with combining the two, so you might get some scaling, and overreaction of the skin. So I really do stop the retinoids. Now they could still use alpha hydroxys, they could still use grapeseed extract, they could still use a vitamin C, and a powerful antioxidant for the skin that I'm using now in my Ivermectin Plus cream is melatonin. So they could still use the Ivermectin Plus, they could still use melatonin, and if they're using that separately, the Ivermectin Plus has some melatonin in it. So they can still use those. I haven't seen a problem with that. If after they've gone through the IPL, the Toyos IPL protocol, after the 4 treatments, if they want to go back to using the retinoid, they can do that during the maintenance phase of IPL. And then same thing, when they come in for their maintenance IPL, you can go ahead and stop the retinoid. The big one that I wanted to talk about, and this is why I decided to make this video at this time, is a lot of the patients that we're treating definitely do have some skin conditions. The main skin condition that you'll see in dry eye patients is rosacea, acne rosacea. And those patients have those small little abnormal telangiectasias on the epidermis of their skin. That's what causes the redness. And if you could see in those patients that have the rosacea, if you push on their skin, you can actually blanch their skin when you push. That is the telangiectasias, and that is the abnormality in rosacea, where they're making several abnormal telangiectasias on the epidermis that secrete inflammatory mediators that actually break down the skin and break down the meibomian glands. When we're doing intense pulse light, these wavelengths of light actually are absorbed by the oxyhemoglobin in the blood cells and will actually constrict and coagulate those telangiectasias. That's why IPL is a great treatment for rosacea and for getting rid of those telangiectasias. And if you know anything about the history of how I discovered IPL for dry eye, those were the patients that put on the light bulb in my brain that actually this could be a treatment for dry eye. So now what's going on with some of these rosacea patients is they don't want to use makeup to cover up telangiectasias. They haven't discovered intense pulse light to take care of these telangiectasias. They don't know about ivermectin plus, but what they're hearing about is actually Rhofade. So Rhofade is a vasoconstrictor, kind of like when you use Visine for the eyes to close up those blood vessels. It's a different vasoconstrictor than what we use for Lumify, which is a brominidine. This is oxymetazoline, and essentially it's a cream that some doctors are prescribing to rosacea patients to actually constrict those blood vessels so that they don't look so red and they don't have that flushed look about them. So, some patients like that, they put the cream on, it vasoconstricts. There's, like I've already mentioned, there's better things to treat skin rosacea that are better for you. I'm not advocating Rhofade for my rosacea patients, but you have some patients that are using it. Now, here's the problem. What we want when a patient's getting intense pulse light is that we want those telangiectasias dilated so that the wavelengths of light can be absorbed and you can close off those telangiectasias. If they come in and they've already used the Rhofade, they've constricted those blood vessels, and then when you're doing the IPL, you're not going to get as many of those telangiectasias to close off because they're already constricted and there's nowhere for the light to be absorbed. This is one of the reasons why I don't use a whole bunch of different things on the skin before I do an IPL treatment, because I don't want any of those blood vessels constricted. And there's a lot of creams and cleansers and things that have vasoconstrictors in them, and that's not what you want. If you want to take off somebody's makeup, just do with water. They shouldn't be coming in with makeup before their IPL anyway. Some patients do come in with some really mild, thin makeup or a moisturizer or something like that. That's really not going to affect the IPL, but washing the face before with just some water before IPL is really the ideal to treat the skin. Now, if they do the Rhofade in the morning and they come in for you to do the IPL, those blood vessels are constricted and you're not going to get the same efficacy on your intense pulse light treatment for dry eye. So that's something to be aware of. There's some special cases and some special medicines, and as those come up and I find that I'm hearing about them more and more, I'll make another video to give you a little bit of warning. So I hope this answers some of those some questions that I've been getting from patients and doctors on medications to avoid when you're getting intense pulse light for dry eye disease. All right, it's good talking to you. Talk to you guys later.